Imagine this for a moment. A migraine doesn't politely knock on the door. It crashes in. The lights feel sharper. Sounds feel louder. Your head feels like it's pulsing with every heartbeat. And all you want is one thing: relief. If you or someone you love lives with migraines, you already know this truth. There is no single best treatment that works for everyone. But there is a best treatment for you. And today, we're going to help you understand how to find it. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now let's talk about migraine treatment, calmly, clearly, and step by step. Medicines for migraine attacks. The goal during a migraine attack is simple: stop the pain early before it fully takes over. For many people, ordinary painkillers are enough when taken at the right time. Paracetamol or aspirin can work surprisingly well, especially if taken as soon as the headache begins, not hours later when the pain becomes unbearable. One common mistake is waiting too long. Migraine pain is easier to stop early than to chase once it's severe. Anti-inflammatory painkillers. For many adults, anti-inflammatory medicines work better than paracetamol alone. These include ibuprofen, aspirin, naproxen, or diclofenac. They reduce inflammation around pain-sensitive nerves in the brain. Taking the full recommended dose early often gives the best results. However, these medicines are not suitable for everyone, especially people with stomach problems, kidney disease, heart disease, or certain types of asthma. Always check with your doctor or pharmacist if you're unsure. Treating nausea and vomiting. Migraine is not just a headache. For many people, it comes with nausea or vomiting, and this changes everything. When you feel sick, tablets may not get absorbed properly. That's why anti-sickness medicines like domperidone, metoclopramide, or prochlorperazine are often used alongside painkillers. These medicines help calm the stomach, allowing other treatments to actually work. Some even come as dissolvable tablets, suppositories, or buccal forms, helpful when swallowing feels impossible. Triptans, migraine-specific medicines. If painkillers don't work well enough, triptans are often the next step. Triptans are not ordinary painkillers. They target migraine at its source, narrowing swollen blood vessels and calming pain pathways in the brain. Common examples include sumatriptan, rizatriptan, zolmitriptan, and others. The key with triptans is timing. They work best when taken as soon as headache pain starts, not during aura and not hours later. Some people need to try more than one triptan to find the right fit, and that's completely normal. Migraine treatment is personal. However, triptans are not suitable for everyone, especially people with heart disease, previous stroke, uncontrolled high blood pressure, or during pregnancy unless advised by a doctor. Newer options. Gepants. A newer class of migraine medicines called Gepants is changing migraine care. These drugs block a pain signaling chemical called CGRP, which plays a major role in migraine attacks. Some Gepants can be used to treat attacks, and others can be taken regularly to prevent migraines. A big advantage is that they are less likely to cause medication overuse headaches. These medicines are usually prescribed only when other treatments haven't worked or aren't suitable, and often under specialist care. Medication overuse headache. This is something every migraine patient needs to understand. Using painkillers or triptans too often, usually more than 2 days a week, can actually cause more headaches. It becomes a vicious cycle. Pain leads to medication. Medication wears off. Another headache appears. If headaches are happening most days, it's time to pause and speak to a doctor. Sometimes, reducing medication is the path to fewer headaches. Migraine prevention. If migraines are frequent, severe, or disabling, prevention becomes just as important as treatment. Preventive medicines are taken daily to reduce how often migraines occur and how intense they become. These may include certain blood pressure medicines, antidepressants, or newer migraine-specific drugs. Prevention is especially important for people missing work, school, or daily life because of migraines. Special situations. In children, treatment choices are limited. Paracetamol and ibuprofen are usually safe. Aspirin should be avoided. During pregnancy and breastfeeding, safety becomes the top priority. Paracetamol is usually the first choice. Some other medicines may be used cautiously, but always under medical guidance. Never assume a medicine is safe just because it helped before pregnancy. Key takeaway: the best treatment for migraine is not one medicine. It's the right plan, started early, used safely, and tailored to your body. Most people can find relief. Sometimes it takes patience. Sometimes it takes trying more than one option. But migraine is treatable, and you do not have to suffer in silence. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, Medicine Specialist, Diabetes and Hormone Specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.